umuthi hari githomo gitu kia mirimu na urigiti toko tukirongoreria murimu wa goita kana wimbo uria muno makia ukagira ngingo-ini kana haha mumero-ini. Iyo ndio nderetito ya mvenya wa umuthi toko tukinyitana ndagitari thini wa bifitari wa Marusi Kibaki agitumenyithia maingi mege murimu uyu. Oho akagitutariria ugwati uria ukoragwo gikora mundu riria arwara murimu uyu wa goita. Ndugavire mitambo rekituthome hamwe murimu uyu. Ni murimo wihereirie makiria icigo-ini iria ire na bothi wa irio kuria teri na mai makuo mari na unyihu wa iodine. Andu mari ugwatini wa murimu uyu ni aria matakoragwo makiria irio ire na cumbi wa kuigana.
Kwa majina naitwa Dr. Zakia Soketo, a medical doctor at Mama Lucy Kibaki Hospital, majorly in the Department of Internal Medicine and Surgery. Goita is a general term ya could describe enlargement of a gland around the neck, in it was the thyroid gland. You see a mass in the neck, chini ya Adam's apple kwa wanaume. Our first thought ni thyroid gland imekuwa kubwa. So when the thyroid gland imeanza kufura and is becoming visible, you refer to it as goita.
Unene wa wibo gingo-ini niguo ukoranaga mundu arwarite goita muthemba uriku.
So we will describe them based on their presentation, because goita is an enlargement. So we describe how that enlargement is. That is how we come up with the types of goita. So tunaweza sema kuna moja inaitwa dondu la goita, whereby ukishika surface it's a uniform enlargement. Imefura in uniformity, hakuna mlima na mabonde when you touch it. Kuna ya pili inaitwa nodi la goita, hiyo utaanza kusikia kuna mlima na mabonde. Na kuna hili inaitwa multi nodi la goita. Multi nodi la goita, when you feel the consistency of that swelling, you'll feel there's a bit of roughness. Of course, you cannot feel the roughness on top of the skin, but you'll feel there's bumps on it, multiple bumps. Yeah.
Wagi wa iodine kana mahinya maria makoragwo cumbi-ini ni gitumi kimwe gikoretwo gigicungireria mundu kurwara murimu wa goita.
Goita, or enlargement of the thyroid gland, number one cause is low iodine. And you are saying low iodine because iodine is an important element in the manufacture of thyroid hormones. So majorly issues of goita are directly related to iodine deficiency. But otherwise, other causes not as common. Issues come pregnancy can potentiate development of a goita and eventually a thyroid disease. Issues come radiotherapy. Shares zingine kama diabetes can also be a risk factor to development of goita.
Hihi mundu angihota gukurana atia ari na dalili cia murimu uyu mbere athiete vifitari?
Classified in two, either symptoms because of the hormone deficiency, because when you have an enlarged thyroid, which is referred to as goita, then there are symptoms related to deficiency, or rather to which hormone is affected, and then there are symptoms based on that enlargement there. So kama ni hiyo vimbe kifura hivyo inaweza affect the surrounding structures. Na hapo kwa shingo, one of the surrounding structures is the voice box, so unaweza kuwa na hoarseness of voice. The other is the respiratory system, so utasikia mgonjwa anaweza anakohoa, na kama ni mbaya sana anaweza shindwa kupumua. Ingine ni the food system, the esophagus. Pia kama ugonjwa iko inafinyilia hizo structures, then you'll find the patient pia kuna shida na kumeza. The other ones are the vessels around it. So unasikia mgonjwa wakati anainua mkono kuna kizunguzungu. Just to name a few. But now when now you have a goita and you do a test and you find that the hormone is not affected, it can be affected as hyperthyroidism, that means the hormones ziko juu ama the hormones ziko chini. So also those ones have their classical signs and symptoms. So the patient either can come anasikia baridi sana ama anasikia joto sana, ana gain weight ama ana lose weight, depending on hormones ziko deranged in which direction, either up or down. Yeah. Anyone with an anterior neck swelling, so that means mtu yote mwenye kuna uvimbe hapa mbele shingo anafaa kuona daktari. Kwa sababu gani? Kwa sababu it might not be goita, it can be other differential diagnosis. Inaweza kuwa ni the surrounding lymph nodes zimefura, inaweza kuwa ni infection imeingia hapo ikakosi hiyo, inaweza kuwa ni some cysts za ngozi, cysts za ducts. So you have to go to the doctors and inaweza kuwa hata cancer, thyroid cancer or any other form of cancer affecting the structures in the neck. So anytime uko na hiyo uvimbe unafai kuona daktari. Immediately you have noticed that the swelling in the neck.
Guvejwa nejere mwe ya kurigita goita na makirereria wibo we munene na gushogeria murwaru kuremwo riko huhia kana komeria irio.
It depends okay, basically it depends on kwanza how the patient presents number one, and then number two, patient's desires. Because unajua sahi psychologically it's not a very nice thing to have a swelling in your neck. So stigma and everything else can be a factor. So surgery is indicated, not in all cases, because of the cases that you can just treat the hormones and leave that swelling there. So sometimes surgery is indicated if that thyroid is big enough to cause the symptoms that I had earlier alluded to. The coughing, the difficulty breathing, the difficulty swallowing, the fainting, the dizziness when you are raising your hands. It means that it's compressing the surrounding structures. So you can indicate surgery there. Surgery can also be because of the cosmesis. But majorly for us, when it comes to thyroid disease, is to make sure that the hormones are within normal, because the hormones are what will probably be fatal to the patient. Because this disease, when it comes with hormone derangements, it's fatal to the patient. So for us, our key pillars in the management of thyroid is to ensure that the thyroid hormones are within the normal levels. Then decisions will be made on whether to go to theater or not.
Thirikari ya Kenya ni ĩkĩrĩire kũhũrana na mũrimũ ũyũ va gũkinyanĩria cumbĩ ũrĩa ũrathondekirwo gũkũ bũrũri-inĩ ũrĩ na iodine ya kũigana.
The government from 1970, they insisted on iodinating our salts, our table salts. So majority of the salts that we purchase ziko iodinated. In 2009, they increased the amount of iodine in those salts. So we are well protected. That's why the cases of goita, they're not as high as before the 1970s. The other thing that the government has done so far that we appreciate is, or other than iodinating our salts, they have also fortified our other products, so that we also consider those who are not able to take salt as much. So what wataipata kwa maybe unga ugali, other processed foods. So you see, with that we are actually preventing these things before they even start. Yeah, other things that they have done, creating public awareness, not as much, but they have tried, and through these such interactions, you are able to reach a wider population.
Viftare wa Mama Ruth Kibaki onaguo uri na mitaratara ikirire hari kurana na murimu wa goita, makiuga murimu uyu ukinyire hari gicunje kia ivano hari igana guku bururi-ini.
You see, when you are in a hospital, it means you already have the disease. Unfortunately, you come to us because of that neck swelling. So what we will do as a facility, now what we are doing right now is creating public awareness. So that is what we are trying to do, preventing you from coming to us. But the moment you pass that gate and come to us, it means you already have the symptoms. Ushashtuka umekuja. So sisi yetu ni kuchukulia from there, trying to find the cause of why you have this anterior neck swelling, and then sort you out from there. So with the medications and the lifestyle modifications, so nutrition team, surgical team, and medical team will be involved in the overall care of this particular patient.
Mwirari na hanu tuko tugikira gaturumo hari githomo gitu kya muthenya wa umuthi mirimu na urigiti murimu wa goita. toguo ndagĩtarĩ atũtarĩria atĩ wagi wa cumbĩ irio-inĩ nĩ ũndũ ũmwe ũrakorwo ũgĩcũngĩrĩria ũgwatania kana mũrimũ wa goita gũthiĩ na mbere gũtherema thĩinĩ wa bũrũri witũ wa Kenya. Ũngĩkorwo wĩna dalili ta ici ĩtĩkĩra ũkorwo ũgĩkinya thibitarĩ ĩrĩa ĩ hakuhĩ nawe ũkorwo ũgĩteithĩrĩrio na kũrigitwo ona ihenya ũrĩa kwahoteka. Nĩ ũndũ wa gĩthomo gĩkĩ na ingĩ ĩtĩkĩra ũkorwo ũgĩkinyia thĩinĩ wa Kĩheo TV mwena wa YouTube na Facebook ũkorwo ũgĩthoma makĩria tabarĩra ta kana mĩrimũ ĩtiganĩte ĩrĩa tũkoretwo tũkũrehera haha mĩrimũ na ũrigiti. Kĩheo TV, mĩrimũ na ũrigiti, njĩtagwo Mũrina Wanjirũ.